And Jeffrey, I want your take on this question. Andy's eyes, he also asked, what strategies have proved most effective in the fight so far? It seems different countries have different approaches in tackling the outbreak of this coronavirus. Can you assess on the different countries' approaches and their effectiveness?
It's a little difficult to tell because the information you need to really assess it is hard to say. I think from the perspective of protecting healthcare systems, it appears that Asian countries are doing the best. When we look at what's happened in Singapore, in Hong Kong, in Japan, they have really linear growth in the number of cases. And it may reflect the measures that they have taken and how aggressively they've actually tried to nip it in the bud before things go haywire. I think the responses that we see in China and South Korea are really to be noted, because in those instances they experienced rapid exponential growth and the situation really seemed to get out of hand. But the government and the population's response in terms of isolation, quarantine, shelter in place, and active testing really brought the outbreak under control. So I think those are right now are the examples that we need to really look at. Longer term, because we don't have a vaccine, because we don't have effective therapeutic treatments right now, we have a larger problem, which is that if you relax those measures that are in place, which may be something that starts to happen because we may have to do this for months, if not for a year at this rate, you may see a rebound. And then the question is, does the society have the stamina to impose these measures for a very prolonged period of time?